my name is Keisha, and I am the discharge coordinator for the UVA Children's Hospital NICU, and today we're going to be talking about discharge. So to begin with, discharge starts when a patient enters the hospital. Everybody's discharge course will be different at the NICU. Here we would like to think that we would tailor our discharges to each patient and make it patient friendly. So today we're going to focus on patients that will be going home essentially with equipment. So once you see the prepare for discharge orders put in by the provider, the nurse will then have the discharge videos pulled up for the parent, and you can find this at each one of the patient bed places. And so you just scan the QR code, have the parents or caregivers watch the videos. Also, at the time of preparing for discharge, parents will get a prepare for discharge folder, and inside of the folder is a handout speaking to what parents would need to know at home to care for the infant. Also, many of our patients go home with equipment such as oxygen or G tubes or NGs or ostomies. At the time of preparing for discharge, equipment orders will be placed, and it is up to the bedside nurse and also DME companies to teach patients. And so at the time of entering in the discharge orders, a handout will be given to the bedside nurse. For example, this is a G2 booklet handout, and inside this is a caregiver's guide, and the nurse will just review with the parent or caregivers how to care for the G2, and then the DME company representative will come around and teach on how to administer the feeds via the pump. This also will happen for the NG as well. At the time of preparing for discharge, the nurse will go over with the family how to insert the NG and check for placement. They will also have a stethoscope given to them to give to the family to check placement that they will take home with them. And then we'll log into Epic, and on the CH discharge checklist, there is a list of things to go through for checkoff for discharge. And for the complex patients, there is a section that says complex discharge checklist. You'll then click here and you'll be able to expand out. There's a selection as to what the patient might be going home with. So for example, if a patient has a G tube, you would select gastric tube. And from there, you double click and it expands out. And as you teach, you would select the primary caregiver, and if there's a secondary caregiver, and you go through each step. Talks about receiving the G2 packet, and so you just go through explaining its return demonstration, and that just ensures that the caregiver understands the proper care of the G-tube, understands the recipe for the formula, and understands how to change out the tubing, and if there's any issues, they can identify if there's risk for infection. Also, at the completion of the teaching, if the nurse feels like the parent is not successful or has some gap in education, it's best for us to advocate for our patients by letting the physician know that the parent needs a little extra teaching. Also, parents are encouraged to room in and to be present for feedings to help facilitate with discharge so that they can be successful at home. But if you have any questions when it comes time to preparing for discharge, you can always reach out to your discharge coordinator, also to your case manager, or to your provider. So thank you.